6, John? Good morning, everyone. We'll start today's Metro COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. We're joined today by Dr. James Hildreth, President and CEO of Meharry Medical College, Dr. William Schaffner, Professor of Preventative Medicine, Department of Health Policy, and Professor of Medicine, Division of Infectious Diseases at Vanderbilt University School of Medicine, who is joining us by WebEx video conference, and Hugh Atkins, Environmental Health Bureau Director at the Metro Public Health Department. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Starting today, we will begin phase 3 of our roadmap for reopening Nashville. Now, our 14-day case average is trending upward, but our testing capacity continues to increase, and more than 81,000 Nashvillians have received a COVID-19 test across Davidson County. We currently have 125 contact tracing investigators, well above our target of 105. Our healthcare capacity remains in good shape. We currently have 27% of floor beds and 24% of ICU beds available at our local hospitals, and that all exceeds our target of 20% for both of these vital resources. Like our neighbors in other states and cities, our public health experts have determined that our COVID-19 public health benchmarks remain within an acceptable range to safely begin phase 3. We learned valuable lessons during the 4 weeks spent in phase 2 of our roadmap. And our plan is to remain in phase 3 for at least 4 weeks as well, which will allow us to adjust our response to the coronavirus to protect public health. Now, in phase 3, much like at a restaurant, local event and small venues may open at 50% of capacity and no more than 250 people, whichever is less. And these venues must have seating and practice social distancing. Bars not previously open may open at 50% capacity, and tours may operate at 50% capacity with public health measures in place. And Metro Park facilities that were previously closed, including playgrounds and basketball courts, may open. The recommendation is to keep informal group gatherings to 25 people or less. Additionally, camps, including day camps and overnight family camps, may operate at full capacity, provided social distancing can be maintained at all times. Phase 3 also permits the opening of schools and educational facilities with proper restrictions to protect students and faculty. We stated at the very beginning of our COVID-19 response that our decisions would be made with our public health partners. We listened to our public health experts in making the decision to begin phase 3 based on all public health criteria, including our COVID-19 testing capacity, our growing contact tracing staff levels, and adequate hospital capacity. Now, these experts, and I want to thank them, include Dr. James Hildreth, President and CEO of Meharry Medical College, Dr. William Schaffner, Professor of Preventive Medicine and Health Policy at Vanderbilt University School of Medicine, and Dr. Tim Vandekar, Chief Medical Officer at HCA's TriStar Division. And as we continue our phased reopening, the health and safety of Davidson County residents remains our top priority. We are working to keep Nashvillians healthy as our residents return to work, but it is you who will keep our city safe. Practice safe social distancing and wear a face covering in public spaces. And get a free COVID-19 assessment and diagnostic test at one of our community assessment centers. You can learn more at Metro's COVID-19 website at covid19.nashville.gov. We still have a lot to learn about the coronavirus, but as Dr. Jahangir mentioned last week, what we've learned about the virus, particularly through contact tracing, has shown that we must all continue to maintain healthy habits, especially when gathering with family and friends, to slow the spread of the disease. After over 7,000 contact tracing investigations, we've learned that the disease is not necessarily spreading because of Nashvillians shopping or going to church, or to grocery stores or local retail establishments, outdoor activities, hair salons, or to other businesses that are taking safe precautions. Limiting the spread of the disease is about maintaining a safe social distance from others and wearing a mask. We know that these are important ways to slow the spread of the virus. Employees at all work sites should practice social distancing and wear a mask. And Nashvillians within a household of someone who has tested positive or been exposed to someone who has tested positive for COVID-19 should receive a test immediately. These are all important ways of keeping yourselves and each other safe while continuing to take part in our local economy. Now, this morning, I want to welcome Dr. William Schaffner, Professor of Preventive Medicine and Health Policy at Vanderbilt. Dr. Schaffner is a respected authority on infectious diseases and is joining us this morning by video conference to discuss Nashville's phased economic reopening. And I also want to welcome, as always, Dr. James Hildreth, President and CEO of Meharry Medical College, who is with us today to share his well-informed commentary on the coronavirus and what we can do to keep ourselves and each other safe as more of our residents return to work. Now, Hugh Atkins, the Environmental Health Bureau Director at Metro Public Health, is also here this morning to provide an update on the department's enforcement actions to protect our residents. Now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 8,182 confirmed cases. That's 139 new cases in the past 24 hours. There are currently 2,063 active cases in Nashville, and a total of 87 Nashvillians have died because of confirmed COVID-19 infections. We are now testing around 8,000 Nashvillians each week, and the percent of tests that are positive is still around 10%, a number that has been consistent since mid-April. Our metrics show the impact of this virus in the community's readiness. This includes our hospital capacity and mortality rate. This morning, we have 27% of floor beds and 24% of ICU beds available. Also, 113 people are currently hospitalized in Nashville hospitals with COVID-19. Our hospitals are keeping up, and our residents that need care are getting it. And the city's mortality rate at 1.1% continues to be lower than the state, and the nation's mortality rate is 4 times higher than that of Nashville. Now, after consultation with medical experts and our public health team, the mayor made the decision to move to phase 3 after 28 days in phase 2. Many of the restrictions in phase 2 remain in phase 3. Restaurants, gyms, hair salons, and retail stores will operate at the same capacity as they did in phase 2. Personal gatherings are recommended to be at 25 or fewer individuals. Work from home continues to be recommended, and those over 65 years of age or those with other medical problems should stay at home if possible. Now, the changes in phase 3 do include events and small music venues may open for weddings and other functions at 50% capacity or no more than 250 people, whichever is less. Bars not previously opened up may open at 50% capacity. Tours may operate at 50% capacity with social distancing in place. And park facilities such as playgrounds, basketball courts, tennis courts, rec leagues, and dog parks may open. Now, we will remain in phase 3 for at least 28 days. This will allow us to complete 2 full life cycles of the virus and to evaluate the data before moving forward. Now, please go to our website, covid19.nashville.gov, for more information and to get complete details on phase 3. Now, as a reminder, our 3 community assessment centers, as well as our hotline, is open today. If you have any concerns about the virus, please call our hotline or go to one of our assessment centers. Finally, we are all getting COVID wary. I get it. Many get tired of dealing with it, but we are not letting down our guard. Not wearing face masks, not social distancing, not washing our hands, those have been shown to cause this virus to spread in our community. It is these lack of precautions that are getting people sick, so I'm asking you, please don't let down your guard. As we open up more, we need to be more vigilant. Personal responsibility is critical. The biggest thing you can do is wear a mask and stay apart. Businesses, you can also help by requiring everyone to wear a mask at your establishment, including your customers. And as a customer, we may demand that businesses keep us safe. I have personally walked into places in which employees were not wearing masks and social distancing was not being practiced, and I've walked out. I'm not going to give my money to businesses that don't protect me, and I ask you to do the same. Thank you for all you're doing, and let's keep it up. I now would like to introduce Dr. Hildreth. Thank you.
Good morning, Nashville. Reported data on COVID-19 this past weekend has raised considerable concerns for public health officials here in the United States and around the world. The highest number of global diagnosed cases of COVID-19 in a single day has been reported by the WHO, 183,000 people infected in a single day. And here in the United States, the last several days has also set records. More than 30,000 new infections nationally on a daily basis for the last several days. And 11 states, including Tennessee, recorded record number of new infections in a single day as well. The global and national numbers get more and more sobering. 8.5 million total infections worldwide, and more than a fourth of those here in the United States. 456,000 people have died, more than a fourth of those here in the United States, 121,000. Here in the U.S., especially in the South, younger adults account for a huge portion of the spike in new infections. I have a few thoughts to share with all who dismiss the threat of COVID-19, especially younger adults. People who get infected by the COVID-19 virus expand the reservoir of the virus in our communities. The larger the reservoir, the faster the virus will spread. And if we don't take steps to mitigate the spread could easily become exponential. Furthermore, the larger the virus reservoir, the more likely it is that every family will be affected by the virus by someone in the family becoming infected by the virus. The degree of separation between COVID-19 and someone you care about who is in a high-risk category gets smaller and smaller every time a new infection occurs in our community. Because each new infection that occurs creates a chain of transmission or a vector for the virus into another workplace, another business, another school, another nursing home, another gym, another restaurant, another bar, or another home. Therefore, whether you realize it or not, everyone who fails to take the virus seriously potentially imperils the lives and health of someone else, including someone that you might care about. So whether you're old or young, all of us need to do our part to keep the virus under control. So wear a mask, please, when you're out. Wash your hands frequently and practice social distancing. As we move cautiously into phase 3 of opening our economy, it's more important than ever that all of us do our part. We know what that needs to be, and we know what we need to do to limit the virus spread. So in all the activities you engage in the reopening, please give thought to what you need to do to prevent the spread of the virus. There are safe ways to re-engage those services that have been unavailable to us during earlier phases. As you just heard from Dr. Jahanger and me as well in previous conversations, only patronize those businesses that take your health and the health of the employees seriously. For example, if you get a haircut and the barber or stylist are not wearing a mask, what should you do? Go to another place. If you're going to work out in the gym and you're not happy with the cleaning routines or the ability to practice social distancing, what should you do? Go to another gym. Dining out has special risks and creates some special problems because it's hard to eat and drink while you're wearing a mask. So you should only patronize restaurants that make social distancing possible, because without masks or social distancing, the risk of infection is high. The bottom line is that if we only patronize businesses that take our health seriously, then the other ones that don't take it seriously will catch on, and they will soon follow suit. Phase 3 is a kind of a test for us. as to whether or not we can pull off a new normal. Failing this test would mean having to go back to more restrictive COVID-19 mitigation measures, and none of us want that. And as a reminder, as you've heard me say many times before, the single most important thing that each of us can do to not have to go back is to wear one of these, some kind of face covering when you're out in the public engaging others for more than a few minutes, especially when social distancing is not possible. So Nashville, we still got this, but we each need to do our part not to be a vector or become a vector for COVID-19. And with that, I'd like to turn it over to my colleague, Dr. Schaffner at Vanderbilt.
So good morning, everyone. Mr. Mayor, Dr. Jahangir, Dr. Hildreth, Mr. Atkins, and other colleagues. Nashville's phased reopening was not an easy decision, but was based on good evidence, extensive public health consultation, and one additional very important element: confidence in Nashville's citizens. That is, confidence that we, the citizens, will collaborate and cooperate in opening up to phase 3 carefully, not carelessly. We have been and shall continue to be in a new normal. And yes, this new normal will extend into the foreseeable months ahead. So, you've heard this before, we're singing in harmony. To reduce the risk of acquiring COVID or spreading COVID infection to others, we all need to wear our masks, practice 6-foot distancing wherever possible, avoiding attending large gatherings, and certainly not going out in public if you're feeling unwell. So I call upon our community's leaders, our political leaders, public health authorities, every business owner, the Chamber of Commerce, religious leaders of all faiths, leaders of our educational institutions ranging from preschool to postgraduate education, to all sing in harmony here in Music City. Wear masks. Please observe that 6-foot rule, avoid large gatherings. If we harmonize, the results will be sweet music. If we're off key, not only dissonance, but disease caused by COVID will result. We can all do this together, both for ourselves and for each other. I'd like you all to enjoy this summer carefully. Thank you very much.
Thank you, Dr. Schaffner. I'd now like to introduce Mr. Hugh Atkins with the Metro Public Health Department.
Good morning. I'd like to give a brief update on compliance and enforcement activities. Metro Public Health Department continues to receive complaints through Hub Nashville regarding the guidelines for reopening. And this past week, we received and responded to 310 complaints. 31 of those complaints were repeat complaints that generated site visits from the environmental health specialists within Metro Public Health, and we issued 8 more citations this week. Most of the complaints continued to be related to employees not wearing masks. Of the 310 complaints I mentioned, 261 involved face masks. And that is concerning, of course, but wearing a mask is the easiest measure to comply with for a business. So we would ask that if you are implementing reduced capacity, you are social distancing, you're putting up the required signs, please go a little bit further and make sure your employees are wearing the masks. Even in the places we responded to, 23 of the 31 we went out on because of repeat complaints were in compliance when we got there, so that is encouraging. We overall see far more places when we're out that are complying with the guidelines than are not. And we appreciate those businesses that are making the effort to follow up on the guidelines and doing their part to reduce the risk for their employees and their customers. Even in the places that we can tell by their operation are taking the guidelines seriously, we continue to see random employees that are not wearing the face mask completely over their nose. So we ask that you make the effort to wear the masks properly to provide the full measure of protection to your customers and your employees. And of course, we're still receiving complaints regarding things that weren't allowed in previous stages, and now we move on to phase 3, so more businesses are going to be allowed to open and operate legally. So keep that in mind when you are going to Hub Nashville to register a complaint. Some businesses, especially the post office and places like that, are doing a good job with plexiglass to protect their employees. So if you see that out there, that is an acceptable measure to provide a level of protection between you and the employee. And again, if you see something that concerns you, please enter a complaint on Hub Nashville at covid19.nashville.gov. While our orders require employees to wear masks, there is no such requirement for individual citizens to wear them while they are out and about. But we still ask everyone to consider a mask while you are out in public. Don't think of it as doing it for yourself, but doing it for others. And we all get the benefit from our fellow citizens wearing these masks. We need everyone's help in taking these basic measures to reduce transmission. Masks, distancing, avoiding crowds, avoiding poorly ventilated spaces, proper hand washing and hygiene. Each of these measures individually is only partially effective, but by combining these efforts, we can achieve better results for the reduction of transmission. And I realize that these measures can create inconvenience for all of us, but during a pandemic, we must at least be willing to abide a few inconveniences. Thank you.
Thank you, Mr. Atkins. We'll now begin taking questions. We'll start with Nancy Amons at WSMV. Nancy.
Hi, thank you. I have two questions. In general, how concerned are you about the situation across the country with the numbers going up? And I know you've addressed that, but I know a lot of people are following the numbers across the country and across Nashville and are really worried if this is the right time. And the second question is, can you comment on the situation at Zanies over the past weekend? Are you going to try to do contact tracing to see if any of the folks who were there require them or ask them to test to have a test?
So your first question is about simply numbers nationwide, and then your second question was about the incident at Zanies. Dr. Jahangir.
Thank you, Nancy. You know, obviously, you know, we were watching the numbers go up across the country, across the nation, across our state, and in our city. But in our decision to reopen or advance in our phases has to do with some of the other metrics I've talked about as well. But I think what is critical here is that wearing a mask has been the message that we've all shared today about how to prevent this from spreading. Wear a mask, social distance, and we can write all the guidelines. The mayor can stand up here and say this, but we need leadership from everyone, right? Leadership from our council members who've been such great partners in this, leaders from our community leaders, from business leaders. We need everyone speaking up to minimize the risk of spread. And the most effective way to do that is to wear masks and to socially distance. Now, we'll continue to watch. Again, we've been fortunate our hospitalizations and our hospital capacity have been stable. We'll continue to watch those metrics, but just say we're always concerned, right? We want to make sure that the burden of disease in this city is at a manageable and ideally low rate. So we'll continue to watch those. And I'll defer to Dr. Caldwell for the next question. Thank you.
Good morning. I've been in contact with the management of Zanies over the weekend, and we're assured that all of the employees, as well as all of the guests who are at any of the shows on Thursday and Friday, have been informed, and our recommendation is that they do go seek testing. We will put this in as part of our normal contact tracing work.
Julia Palazzo, WKRN.
Good morning, everyone. Thank you. Just a couple questions. Do you plan to add more contact tracers with phase 3 beginning? And I know you guys have talked about, encouraging people to wear masks this morning and seeing for yourself that people aren't wearing them. But the Memphis City Council just approved a mask ordinance last week. Is that something that Nashville is considering or will consider doing, requiring people to wear masks in public? Thank you.
Thank you. Dr. Caldwell.
We now have over 120 contact tracers, and if the number of cases continue to increase, then yes, we will be adding more additional contact tracers. For face masks in public, we make strong recommendations that people wear face coverings while in public, especially indoors, especially when they're around others. We have required here in Nashville, Davidson County, and still do, that you must have signage at every door asking people to please wear facial coverings when they go inside. And we're requiring that employees wear facial coverings, and as you've heard earlier, we are enforcing that. We want also to encourage businesses that they require facial coverings for people who go into their facilities, but that is an option left up to them. Now, Mayor Cooper, with his leadership, passed Executive Order number 7, requiring that anyone who goes into a metro government building must wear facial coverings. And we'd like to see other business owners follow his lead in doing that. It's important to remember that we want to be respectful of everybody, to reduce tensions in our community, and try to guide people and educate them to all wearing facial coverings. And I think that we're making progress.
Harriet Wallace, Fox 17.
Good morning. I've got 2 questions. My first question is, in light of what we're seeing in terms of the 14-day average spike, what we're seeing across the country as more cities and states reopen, cases are going up. What are your concerns about that in our Nashville area as we enter phase 3? Our numbers are spiking a little bit in terms of the 14-day average, and we're opening even more. Your thoughts, concerns about that, and what we may see happen. Will we revert possibly to another phase? Second question, this comes from one of our viewers. They want me to ask Dr. Hildreth about the use of, and forgive me if I'm pronouncing this incorrectly, but dexamethasone for the treatment of COVID-19. Can you please respond to that? Is it effective? Should it be taken? Thank you.
Thank you, Harriet. We'll start with Dr. Jahangir.
Thank you, Harriet. Again, cases are going up, as you've mentioned, but I want to highlight, hospital capacity has stayed stable. Number of people in our hospitals have stayed constant for over a month now. It is everyone's responsibility to prevent this virus from getting worse in our community. So again, I'll say it again, wearing a mask is critical. Please, as members of the media, I'd love for you guys to help us also in getting that message out. But within the city, we are following these metrics that we talked about. And again, I'm really happy that our hospitalization capacity and our number of people hospitalized have been stable. And we'll continue to monitor this. And I think your question of would we ever revert, I think what has changed between now and March is we have this amazing team of people who can quickly do contact tracing. Within 48 hours, over 90% of people, we know the whole story of how they got the disease and where it spread. And if there's ever a quick trend that we identify, we can do again, I'm a surgeon, so pardon this terminology, of a surgical strikes on that specific area, and try to minimize spread by making perhaps further amendments to whatever orders at an area that's causing spread in our community. And it's that contact tracing that's allowed us to see that, you don't get this by going to the grocery store. You're not getting this by going to your hair salon. You're not getting this by maybe taking a walk in the park. But we'll continue to monitor that and make amendments as needed and inform the public, and with your help as members of the media, to do that. And Dr. Hilders, I'll defer to you. Thank you.
Harriet, it's not recommended that people who are not severely ill be given dexamethasone. It's been tested in those who are on ventilators, who are really, really sick in an ICU, and the survival has been increased by about 30%. So it's been used in severely ill patients to try to make sure they can survive being put on a ventilator. And again, it needs to be confirmed in some other studies, but it's very hopeful for that purpose. But it's not recommended that those individuals who are not severely ill be given dexamethasone, because it can create some of its own problems, making you subject to opportunistic infections that are difficult to treat. So this is a very special case for use of this compound. Is not recommended for use other than that. Thank you.
Our last question this morning is from Ian Jung at the Tennessean.
Good morning. Can Dr. Jahangir provide some more information about Saturday's report of 279 new cases? Was there any conversation and disagreement among task force members to, whether to move on to phase 3 today? And a question for Dr. Caldwell, will there be any work to do breakdown of cases by industry or type of employment? And lastly, does he oppose making face coverings a requirement? If so, can you give some reasons? And if Metro Council is successful in passing legislation to do so, would he be supportive of it? Thank you.
Dr. Jahangir.
Thank you. Regarding the 279, there was no, there was 279 cases I reported, right? There was no identifiable cluster. There was no delay in the lab, just 279 cases. But again, we followed the trends, and yesterday I believe it was 66, today it was 139, and of course Mayor Cooper is daily aware of every number, and we've discussed this with him on a daily basis, and there was no, I believe your word is, disagreement amongst task force members to move forward. Our recommendation to the mayor is, with everything we've talked about today, with the precautions, with the things we're watching, to move forward, and the mayor's decided to do that, and so every day, I assure you, that Mayor Cooper and the groups of medical professionals here are following the numbers and in regular conversations. So thank you.
The data that we are going to be continuing to release publicly will include as much information as we possibly can. And we will alert the public when there's clusters at certain facilities, and we've been doing that. We are continuing to look to see how we might be able to break out the data in ways that might be able to help us learn what types of businesses or professions people are. But it seems in general that it's people who are in types of employment situations that tend to be working closely together. But more importantly, what we're seeing is the spread in the home environment. So we really want people to know how important it is that if there's somebody who is positive in your home, that you work your best to try to reduce that spread as much as possible. But also that people in that home should all get tested. Now, to the issue with facial coverings, I've clarified what we are doing with that and why we are doing it. We believe strongly that it's important to mandate something that we can enforce. And right now, that's what we're doing. We're mandating that employees wear facial coverings when interacting with other employees or with the public. We are strongly encouraging that people wear facial coverings in public, especially indoors. And we believe that the community is making progress, and we're going to continue to move forward along that line.
Those are all the questions we have this morning. I'd like to thank Dr. Hildreth, Dr. Schaffner, and Hugh Atkins for joining us this morning. The next scheduled Metro COVID-19 press briefing will air on Thursday, June 25th at 9:30 a.m. Daily updates will be posted at covid19.nashville.gov. Thank you for joining us. This concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.